Welcome back. Another episode of the Friends of NPACE Podcast. We are here in person today at the office. We're back. Myself and NPACE Executive Director and Nurse Practitioner Terri Schmitt. Terri, how are you today?
I'm good. How are you, Josh?
I'm great. We were just saying this is a bit of a flyby the seat of the pants Friends of NPACE Podcast. Terri making a surprise visit to us here at NPACE headquarters today, which we couldn't be more excited about. And what we're going to do today is really cover everything else that NPACE has going on from a continuing education standpoint in our events for the rest of 2024. And I think this is going to be one of the first places that folks can learn about our 2025 events, the locations that we're going to, a couple nuggets of information in terms of different speakers and content that's going to be happening at each of our 2025 events. So we're just going to go location by location in chronological order for the rest of 2024 through 2025. And that's what our agenda will be for today.
I'm actually very excited.
Me too.
These things. So
I know we started our planning process for 2025 back in January. And the two of us, as well as Catherine, our fantastic event planner, we're all out on the road sourcing hotels. And we're really excited. This is probably the best part of NPACE in terms of seeing the process of what we go through from the time that we source our hotels to booking them, to getting to tell our nurse practitioner audience and now PAs as well.
Oh, yes.
About where we're going, and soon enough all these events will be here. So without further ado, let's get started. The one that's on the horizon and coming really quick in the next couple weeks is our NPACE Boston Primary Care, Pharmacology, and Acute Care Conference. Big one for us, taking place at the Westin Copley Place in beautiful Back Bay neighborhood of Boston. Lots of different things going on at this conference, Terri. We're kicking things off with 2 days of pharmacology, and then one of the few times that we do two tracks at once with acute care and primary care. So what's going on in terms of Boston, in terms of content, speakers? What do our attendees have to be looking forward to?
This is a fantastic location, and I could talk a long time, so I'll try to condense it.
Sorry.
A few things. So from an educational standpoint, because I'm a practicing advanced practice provider, we're really trying to answer some major questions. So we have great farm content. We use a variety of speakers, not the same person every day, and we really are in the heart of Boston. Big announcement is our PA brothers and sisters can join us for this, particularly with the acute care track. That was important. We have CME as well as nurse practitioner credit, and our physician friends can join us as well. Plenty of farm credit here. We're going to do a GI pharmacology update. Dr. Peter Buck's going to be with us. Wendy Wright's going to be with us here, and she's going to do, I know she's fantastic, a 2024 pharmacology update, which is going to be fantastic. On the acute care side, we're going to do a workshop on shock. We are going to cover vent management, airway management, abdominal trauma. But then we also have some nationally known speakers in the advanced practice provider space. So Jen Carlquist comes to mind. If you guys don't know Jen Carlquist, she's fantastic. She's a great cardiology teacher, and she's going to come to us and talk about heart failure. She's going to talk about cardiology drug updates. We're going to talk about polypharmacy in geriatric patients, right? Too many medications, how to remove that. But we also have some cool partner sessions. So we have hands-on continuous glucose monitor training with Dexcom. If you want to know what your patients are dealing with a CGM, there are a few seats open. It's a limited
registration for that event taking place on the first day. Once we wrap up the continuing education portion of sessions that day. But yes, Dexcom will be with us at this event to go over their G7 product. And it's they did it with us in San Diego last year. Very well received, and just a fantastic way to learn exactly from the Dexcom staff who has their hands in setting up the app and getting it ready for their patients.
Yeah, and one of the things we're hearing about in needs assessment is just knowledge like that for diabetic patients, but also obesity. There will be some GLP-1 partners who come to talk about those medications. We are also doing some education sessions with the world-renowned Angie Golden. Dr. Angie Golden is actually obesity fellow, and she's going to talk about whether healthcare providers are actually contributing to that or not, and how to do lab interpretation. So it's all going to mix together really nicely. And we have cool things to do. Donut tour discount, just saying.
Yes, but most of us that work for NPACE are from the Boston area, so we're excited for this event and sort of hosting an event in our backyard. Back to Wendy real quick, because she's doing like 8 different programs at this conference.
Partner education.
Yeah, so she's doing some pharmacology content. She's going to be speaking for Exact Sciences on colorectal cancer screening and a great program on Cologuard. She's speaking for PCEC as well for another partner continuing education session. So lots of Wendy featured on the schedule. We're always happy to have her. And as we were just saying, Boston is our backyard when it comes to NPACE, and we've been hosting events there for several years. And the Back Bay neighborhood of Boston is just fantastic. You walk out of the hotel, we're right across from the public library in Boston, which is beautiful. Newberry Street is a 5-minute walk with shopping, restaurants, the public garden.
We're going to a Red Sox game too.
Yes,
the Sox are in town.
The Red Sox are playing at Fenway every night of the conference in terms of it's taking place. Tickets are very reasonable, $30 to $40 to get in the door. So highly recommend if you're traveling to Boston for it, or you're thinking about coming to Boston, tacking on a Red Sox game and Fenway experience. There's nothing quite like it if you've never been. So we recommend that. So anything else Boston-wise before we jump over to...
That's great. Good talk for
All right. Yes, we have lots of other things to cover here. So right after Boston, quickly approaching in September as well, is our 2-day virtual conference that's talking on all different things primary care. And so, Terri, let's tell the audience a little bit about what we have going on in September.
So I love the virtuals because you can be anywhere at any time across the U.S. and go. So it meets you where you are. The September one is actually the conference you didn't know you needed. So topics are fantastic. Our keynote is Dr. Lynn Rapp-Silber. She runs an entire organization on starting your own business in healthcare and entrepreneurship. So she's going to talk to us about that. But she's also doing 2024 Medicare and Medicaid billing and coding updates, mostly Medicare. And who doesn't need that? That's what we struggle with. The topics are completely unusual. We're going to, of course, my staff has heard me talk about this. We're going to do a syphilis update. We have got to talk about it just because the rates are increasing so much and there's issues in getting penicillin to treat syphilis. So we'll talk about that. We're going to talk about climate change and how that's going to affect what you're seeing as primary care, being prepared for that. We're going to talk about men's urological infectious disease updates. We haven't talked about that. Yeah. We have a fantastic speaker from Miami. He has his own social media channel. He does his own podcast. He's going to come and talk about that, and also erectile dysfunction and testosterone updates, which we don't get those updates very often. So I think that's going to be really important. Some of the other stuff that's happening in September is we've got some really good partner education on diabetes and other things that are going to
very
great too.
Very excited to have a few of our educational partners with us in September. So Peerview Medical Education will be doing their diabetes program as well as a dermatology program at the event. We have our friends at the American Association of Clinical Endocrinology. I got that all out correctly. So they'll be doing a diabetes technology program. And then we also have our great friends at the National Psoriasis Foundation doing a psoriasis update for advanced practice providers. And so really excited, great combination of partner education as well as all the things that you didn't know that you needed, as Terri just mentioned, at the September virtual conference. September 19th and 20th, taking place all online. I think the most important thing to know is we know folks' schedules are busy. So everything is recorded. Everything is recorded. People always ask us, are you recording this? Can I come back and look at this?
Yes.
The answer is yes. And that's true for all live.
Every single conference.
And virtual.
Emphasize that enough. You have access for 90 days. In case you need to go over to the Sox game early in Boston, you can watch that session later.
Yes, or if hopefully we get a beautiful week down in Cape Cod in October and you sneak on out to the beach.
Good segue.
And I try.
That's great.
So we'll shift gears to our Cape Cod 3-day pharmacology conference taking place at the Seacrest in beautiful Falmouth, Cape Cod, October 8th through the 10th. We're really excited. Catherine, our event planner, was just there a few weeks ago, and they've done some amazing renovations to the hotel. So brand new gift shop, renovated restaurant, outdoor space has been renovated and updated with brand new furniture. So really excited to see some of the changes that they've done down at the Seacrest. And fall time in Cape Cod should be a beautiful time to be there. Depending on weather, you may see me in the water still. We'll see. But with that being said, 3 days of pharmacology. We have a fantastic theme for this event going on as well, with Halloween, one of your favorite holidays, Terri, right after this conference taking place. So let's talk about potions and spells, building monsters, and everything else we have going on in Cape Cod.
We're playing around a little bit with this 3-day, mostly because I love Halloween and this staff is indulging me. One thing I didn't know as an outsider coming into Cape Cod is just how relaxed the feel is. This is really a time to get away and fill your own cup while learning about really interesting things. So day one, the theme is building monsters. We have the fantastic Dr. Chris Hemmer. He's going to come in. Everybody gets to do a wound closure workshop. There's no additional fee for that. We are going to talk about all kinds of wound closures for the first hour to hour and a half of that. And then his specialty is urgent care, ER, and orthopedics. We're going to talk about orthopedic pharmacology for knees and joints. And then we're going to move into procedures. Do we need to do them, when to do them, joint injections, etc. So that's day one. The theme is building monsters.
Yes.
Because that's, in case you want to take this back to your secret lab to build a monster, it'll come in handy. Day two is potions and spells, and we are going to hear from Dr. Efrat Lamondre. She's fantastic. She has her own podcast also, but she's a nurse practitioner who also does functional medicine, and she's going to introduce us to the foundations of functional medicine, why it is what it is, and then jump into gut health, how that affects skin and prevention of Alzheimer's disease. We're also going to tackle things like anxiety. How do we remedy that non-pharmacologically? So we have a fantastic nurse practitioner who's going to be with us. She's going to do the yoga and wellness there, but she's going to do some education for us, things we can really take into practice. And then day three there, we're going to talk about infectious disease with one of our great ANCC board members and a local PA here. We're going to talk about infectious disease for respiratory diseases. And we're going to talk about outdoor emergencies, bites, stings, rashes, things we don't normally talk about. So it's going to be a great 3 days. The beauty of a 3-day conference is you can come in, you can enjoy, and you can get home. But we also have cool things to do at the Cape and discounts. If you've never been, you should go.
Yeah, the nicest part about the Cape is at the Seacrest, you walk right out. The beach is right there for you. So if you're a beach person, it couldn't be better. But if the beach really isn't your thing, there's also so much in Cape Cod to be able to do. We're 10 minutes from downtown Falmouth that has so many different things. They have art galleries. They have lots of different things. Cape Cod is a popular place where folks bring their families as well. So they have some family entertainment. Yes, Anejo, great spot. If you're coming to Cape Cod, we have, let us know if you need some restaurant recommendations. We can help you with that. Woods Hole as well is very close. The ferry to get over to Martha's Vineyard is right there. So if you want to come on the early side or extend your trip, it's a holiday weekend after the conference takes place, and we have a great rate at the Seacrest. So Cape Cod in the fall time, fantastic place to be. And we're looking forward to getting down there. It's relaxing for the staff as well. We're done by like 3 o'clock most days, so you get to enjoy the afternoons.
There's going to be activities on site at the Seacrest this year, so we're tossing around. There will be an organized clam bake. There's going to be s'mores and a gathering. We have a paint and sip night if you want to participate in that. And we have wellness everywhere, so we didn't emphasize we record everything. Got 90 days to watch it, but also we try to do wellness everywhere. There will be some stretch breaks. There'll be some yoga. We're doing cardio in Boston, so we want you to get up and move, fill your own cup, and take care of yourself.
Absolutely. Can't be sitting there for 8 hours or, well, not quite 8 hours. I shouldn't say that. 6 or 7 hours each day. Some great partners with us in Cape Cod as well. Novo Nordisk will be with us to go over their diabetes portfolio.
Nice.
And then we also, I believe, have Bayer, who's going to be talking about women's contraception, a very important topic as well. So excited to have them in a beautiful exhibit hall there. So, and we're going to wrap up the year with another fantastic location, not quite on the beach, but on the coast in
gorgeous.
Dana Point, California.
Beautiful.
I think I've said this on other podcasts, but my favorite place that we get to go
So
for
gorgeous.
NPACE events. So Marriott Laguna Cliffs, this event is taking place November 4th through the 7th, and it's going to be a 2-day primary care, 2-day pharmacology conference. Still space available for folks to register, so you can find more details on npace.org to register for this event. And Terri, what do we have coming from a education standpoint in Dana?
So you can see that each of our conferences are very different. One of the things we're going to do here is focus on opioids and cannabinoids. We have Dr. Teresa Malik-Searle. She's going to come and speak, and she's phenomenal if you've never heard her. Wendy Wright's also going to be with us there, and we're going to do PEDS updates. So pediatric pharmacology updates and an immunization update, which will be important for winter and fall, taking us into that season. Sally Miller's going to be with us. She's going to talk about evaluating the dizzy patient. I mean, how many of us struggle with that? When someone comes in with that complaint, I'm like, So she's going to talk to us about that, and cytochrome P450, metabolism for drugs, all critical to practice. Josh Hamilton's going to be with us there, and he's going to be with one of our partners. I'll let you talk about that, but he's going to talk to us about de-escalating the anxious or angry patient, and I think we can't talk about that enough. So I'm just thrilled with everyone that's going to be there. We are also going to have wellness here. Our wellness speaker, she actually is certified in helping healthcare providers deal with their own trauma of healthcare, helping them de-stress, and she's going to do a presentation on that. So it's just going to be and if you have not been to Dana Point, California, so beautiful. This is your chance to go. The room rates are fantastic. We will have local discounts there on things like whale watching. We have a winery. We have a massage studio that has discounts. So it's a conference not to miss, definitely.
Completely agree. Dana Point, as Terri just mentioned, beautiful place right off the Pacific Coast Highway. Lots of different airports that you can choose from to get into Dana Point. So we really look forward to that event, wrapping up our conferences in 2024. You did mention one of our partners that will be with us at Dana Point, the Point of Care Network, and they will be hosting a dinner program in Dana Point. That's going to be networking. I believe Josh Hamilton and Wendy Wright will be there to present a little bit, talk about the Point of Care Network, a fantastic organization that helps provide advanced practice providers with some resources and education, and we're very happy to be partners with them. So if you're registered for Dana Point, we'll be sending out some more information on that dinner program, and if you aren't registered, please do, and then we'll get that over to you. So that wraps up our content and in-person events that's taking place in 2024. As always, if you're not able to make it in person, we have our Learning Center at learn.npace.org with several courses and bundles to choose from. Most of our content is recorded directly from these conferences that we're talking about, so you're really not missing out. So whatever your learning style and preferences, we're there to meet your needs. So that's the rest of 2024. And we're really excited now to turn the page and look ahead to 2025. This is, I think, the first time that we're really talking about where we're going, the dates and locations. Now, I know we should. And content is obviously still developing in terms of what we're going to have taking place at each location. But we'll dive into as much as we can with what we have planned so far. So really excited. I got to go out to Las Vegas last January and got moved around the city like I've never been moved around a city in 48 hours. And after all of that, we are going to be at the beautiful Bellagio Hotel February 11th through the 13th for a 3-day pharmacology conference. The Bellagio just made some beautiful renovations and updates, so the guest rooms are all brand new with brand new beds. We know Vegas, there's people have certain feelings about Vegas, but the best part about the Bellagio is if you're really not looking for the traditional Vegas experience and staying away from the casinos and gambling and all of that. The hotel and conference center at the Bellagio is completely separate and apart. You'd never have to see the casino floor at the Bellagio after you check in if you don't want to. And as we know, Vegas has everything from an entertainment, food, dining, shopping standpoint. So,
and you can't beat that time of year there. It's cool at night, bring your jacket, but during the day it's gorgeous. And note the dates. If you need an excuse to take your sweetheart somewhere, you can get a great roommate for Valentine's night. Just saying.
Completely agree. So there will be, as we mentioned, February 11th, 13th, 3-day pharmacology conference. Do we know who's coming? What's going on in Vegas? Place? All right, let's tell the people.
Made anyone sign a contract yet, but Vegas is going to be that conference where we're going to have some topics no one else is talking about that we need to be talking about in primary care. Dr. Sheldon Fields is going to come with us there. We're in talks with him, but he's going to do the keynote on nursing and the nurse practitioner profession and what it looks like. He's also going to do an educational update for us on HIV and PrEP and PEP. That is his specialty area, so he will be there. I hope that we can have one of our great speakers there who's been on podcast with us talking more about cannabinoids and using that in your practice. We hope to have some women's health updates there. We're going to have some cutting edge and maybe a little bit controversial topics, but it will be a 3-day event you don't want to miss. And if you're a huge Vegas fan or you're out on the West Coast, want to come to this one.
Absolutely. And we're hard at work to have some discounts and fun things to do in Vegas. We will have a whole array of options for folks to be able to take advantage of. So discounts on attractions and all the different things that you can do, all the different shows that are happening. We're hoping to partner. So more to come on Vegas. Registration for 2025 is going to launch late September, early October. That's our goal. And so stay tuned for everything coming up for Vegas.
Just a note, John Mayer, if you're listening, you really should book this beer with Ted and Company again.
Or yourself, if it's you, if it's you solo or the Dead, we'll be there.
Okay, continue.
That's all right. We're both big fans of John Mayer and everything he does. He's up there in terms of guitars. The next event that we have in 2025 is perhaps, I don't want to say, they're all very important, but I'm really looking forward to this, and it's information that providers really need in the advanced practice space. And we're partnering with two fantastic organizations, the Association for Community Cancer Centers and AppShow. And we're going to be doing a 2-day virtual conference on what advanced practice providers need to know from an oncology standpoint.
Yeah, and I hesitate to use that word first. So these are our oncology friends, but what I'm seeing more and more in my practice is specialized screenings, who to screen and what, not just the standard. And how do I co-manage those patients with oncology? So we're really directing this toward primary care, and it's all the stuff you didn't know you needed to know that they didn't teach you at school. For instance, one of the topics is the CBC, when not to panic. So we're on a meeting and I'm with these other advanced practice providers and they're like, a platelet count of 20, it's okay. I'm like, oh my God, platelet count of 20. So it's going to be a fantastic 2-day that's virtual. So for all PAs and nurse practitioners in primary care, it's a topic you're not going to want to miss. You didn't get this anywhere else. You didn't get it in school. You're not getting in practice now. We just cannot kick those patients entirely to oncology and say, goodbye, we'll see you at the end of your treatment. That's not how this goes.
Exactly. And I think it's really going to talk about what you just said, the advanced practice provider's role in that oncology care-based team. And really, how can you help your patient? Because we all know that primary care is the first place that a patient is going to whenever they have anything going on. And so really looking forward to that. 2 fantastic partners, as I mentioned, for that virtual conference, March 12th and 13th, virtual, same thing as what we've talked about previously, virtual, recording access for 90 days after the fact, and then it will be available on the Learning Center at some point as well. Excellent. And then we quickly ship on over to the Midwest. Really excited to get back to the Midwest this in 2025. We're going to be heading to Chicago and the Intercontinental that you got to visit.
Oh my It's beautiful. Yeah, I got to go to Chicago. And it was cold and snowy in January when I went, but beautiful. The city is so beautiful, walkable. I saw some great properties. Here's what I want to say about the Intercontinental. It is right on Michigan Avenue. Like, you are half a mile to walk to the Sears Tower. You can go get a Sprinkles cupcake. You can visit the 5-story Starbucks just almost directly across the road. It's a foodie town. The rivers are there, but that hotel is historic. It has the biggest indoor pool in North America in it. It used to be an Olympic training center. And I got to eat at the steakhouse inside there. Oh,
Michael Jordan's, right?
yes. But the conference area is so unique. It's not like just some big room. It's like theater-like, and there's paintings on the ceiling, and the property is gorgeous. If you like Chicago, you want to check out the Intercon.
Yeah, very excited to be back in Chicago. It's been a little while, and really looking forward to what we have going on there. Do we know any content yet? Are we still sourcing things?
We do. We're still sourcing, but we'll have some of our great speakers there. We work with a great pharmacist who's in Kansas City, and he's going to do infectious disease updates on C. diff and respiratory illnesses, Dr. Eric Wamwell. So he'll be there. He's fantastic. It's going to be 3 days of fantastic pharmacology. We may play around with a theme because, it's a roaring 20s gangster-like city. So you never know what's going to happen for the 3-day farm. But if it's a good time to go to Chicago.
It is. It is. Excited for that. All right. Chicago, 3-day pharmacology, April 7th through the 9th, Intercontinental. And then we are back on the beach in Cape Cod, back at the Seacrest, back in June. I know people have asked us so many times this year, October in Cape Cod.
Yeah.
We are back in June. We, believe it or not, still dealing with some of the fallout from COVID and the way that our schedules and contracts changed, but we'll be back in Cape Cod. That's going to be a 2-day primary care, 2-day pharmacology, so 4 days back in Cape Cod. This is June 9th through the 12th, and everything we just mentioned a little bit earlier in terms of the Seacrest and the location will be available to folks as well in June. And then still planning out that conference, I imagine.
I'm hoping Dr. Secor, who is a Massachusetts native, will keynote for us there. She's very special to NPACE. She's done some podcasts with us. She's just tremendous. And so we're hoping Mimi will join us in the Cape, and then we'll have lots of our other great speakers we normally have. It's going to be good. Yeah.
Really excited for that. And then next summer, the way that our schedule is shaked out is that we are going to be doing a 2-day virtual conference in August. And really looking forward to that. Back to school, so we're going to be talking about a lot of things that in regards to pediatrics at that conference, I imagine.
The virtual?
Yes.
No.
No? Oh,
I have
I was assuming.
a sneak peek. I know. We will talk about that in one of our fall conferences, but it's Lab Fest.
Lab Fest. Back to school Lab Fest.
Lab Fest. So actually it's back to school for the students. So student and new NPs, but anyone can come to this. It's the lab things you didn't learn how to interpret. We're going to have brand new updates. It's going to be amazing. Lab Fest.
Lab Fest. Get ready.
I feel like we should make t-shirts or something for that.
Maybe come in looking like a mad scientist or something.
Or peace.
So Lab Fest, August, I want to say 19th and 20th. Don't quote me on that. I might have it incorrect. Well, virtually.
Yeah. Oh, yes. So I meant somewhere date-wise. Somewhere on the calendar.
Somewhere on the calendar in August. We'll have as we said, we'll have our dates out there late September, early October 2024 on all things 2025. And then we're returning to beautiful Phoenix, Arizona, to the Sheridan at Wild Horse Pass. We were there in 2023 for a fantastic conference, and this is going to be a 4-day event that's going to be where we're going to be doing our acute care conference for 2 days in 2025. So really looking forward to that, and then we'll have our primary care and pharmacology options. You were at the Sheraton 2 years ago. Talk a little bit about just that location and what people can look forward to there.
It's a beautiful and very unique location. That location actually backs up to the native lands that are behind it. We actually had the local Gila River tribe come and open. I think that was just such a beautiful experience. We had local artisans there. We had a lot of wellness. It is a good place to really fill your cup while you do continuing ed. It is not like any place you've ever been. It is not a beachfront resort. It is not a big city. It is just the mountains are there. It's so peaceful.
Almost like a retreat kind of feeling.
It is. And we love our acute care track and our acute care brothers and sisters. And so they will be with us there.
Excellent. So Phoenix, Arizona, Sheraton Wild Horse Pass, September 22nd through the 25th. And then we close out our 2025 conference calendar and perhaps the one of the most sought out destinations for families in the world, back to Orlando, Florida. We're going to be at the Hilton Bonnet Creek and really looking forward to that beautiful property down there. And right in the middle of all of the sort of attractions and things that folks go down to Orlando for. So Disney, Universal, International Drive, all of those within 10 to 15 minutes of the Hilton Bonnet Creek.
And our conference backs up the weekend before is that like Halloween weekend, and they'll still be doing it. So if you've ever wanted to bring your kids to do trick or treat with Mickey Mouse, or you have teenager college kids who want to do Halloween Horror Nights and be scared, and that's your opportunity to do it.
Sure is.
Good time of year.
So looking forward to that. That's going to be a 2-day primary care, 2-day pharmacology. Well, also, do we want to talk about one of our partners that's going to be with us? All right.
Yeah.
I think we're going to have to keep that on the back burner for
We
now.
have exciting guests coming.
Yes,
We're so excited.
really excited for a partner. We're finalizing. We actually have a call right after this podcast with them. So folks will learn about that little teaser there. We'll go into what who's going to be with us and what they're going to be doing on a future episode. And look at that. We just got the meeting notification for noontime here. So Orlando, Florida, November 2nd through the 5th. Our producer, Ryan, his birthday, we're going to be celebrating at Uncle Julio's with a chocolate pinata.
Chocolate pinatas.
So
Side quack.
Ryan, put it on your calendar for about 15 months from now. He's shaking his head yes in the background here. So really looking forward to Orlando. And then lastly, we're going to do a 1-day webinar to close out the year, our winter webinar on December 10th. And that's really going to be, we're planning to have all of our partners join us for that day and help us plan the content. And so as they come to us with what content they have available for next year, we will plan that day out accordingly. So winter webinar, December 10th. And that wraps up 2025 everywhere that we're going.
It's going to be so.
Obviously, as we mentioned, we're still in the planning phases for much of our 2025 schedules and speakers and all of what's going to be going on at each event. So the best place to get updated on that is npace.org. And then you click into each conference location and you can view the conference agenda, the speakers, the amount of credits that's being offered, all the hotel information. We have fantastic rates at these hotels. One of the things that has boggled my mind is how much hotels have gone up. And we are so fortunate in these places to have really, really competitive rates and make it affordable to be able to travel to these destinations. And we also do our best to make those rates available 3 days before each conference and 3 days after each conference. So if you want to extend your stay on either side of the conference, that should be available to you each place we go.
Room blocks fill. They fill. If there's one thing I could emphasize, it's book your room first and book it early. I mean, we're already seeing that with Boston. We've got a couple nights that hotel is full. Cape Cod will be the same way. So several of the 2025 destinations, once the block is gone, that rate's gone.
The rate's gone. That we unfortunately have limited space at most of our locations. And once we run out of rooms, we'll do our best to help all of our attendees as always. But as Terri mentioned, register for the conference immediately after, book your hotel, and read the cancellation policy. If you need to change something or whatever it might be, know what that looks like so that you're prepared to come to each conference location. There's nothing better than when you're at an NPACE conference, you wake up in your room, you come down the elevator, and everything that you're looking for, your meals, exhibits, sessions, registration desk is all right there from centrally located. Coffee all day, every day.
Well,
that's how we survive.
it depends. what the coffee rates are, but we'll make sure you have some.
Coffee will be there. Coffee
Yep.
will be there. So that concludes this episode of the Friends of NPACE podcast. So happy to be able to be here in person
Yes.
with you, Terri, and talk about everywhere that we're going. To all of the providers who have been with us here in 2024 so far, thank you for attending NPACE events. If there's one thing that we ask you to do, tell your colleagues, tell your peers, let them know if you had a great experience that you did, and encourage them to come visit us at any of the places that we're going. NPACE events are family friendly, so we highly recommend bringing your significant other or your children, or we've seen grandparents and whole family expeditions at NPACE conferences.
To meet back up, and also just reach out to us if you have a question or a thought. npace@npace.org, or find us at npace.org, the website. There's a contact us form there. We have a new website too, so check that out.
Beautiful new website, much easier to navigate. Some great work by Skylar, who's helping us to produce today as well in the background. So many thanks to the entire team who helped us get the new website up and running. So with that, we're going to sign off here. As always, remember to subscribe. You can find us all over social media, all the platforms. Just look for NPACE. npace.org is where you can find everything in terms of content and schedules. Terri, always a pleasure to be with you on the Friends of NPACE podcast and getting to do it together. Usually we're co-heading things up here, so it's always great to be together. So to our audience, thanks for tuning in. That'll do it. We'll see you next time on the Friends of NPACE podcast.